All right, let's discuss the inflammatory process in under 3 minutes. Don't go anywhere. More often than not, the inflammatory process is part of the reason the patient is experiencing the symptoms that they're experiencing. So, understanding the inflammatory process so well that you can account for all of the symptoms will help you to better be able to word your diagnostic statements. And I'm going to help you with that. So let's understand the inflammatory process a little bit better. So first, there's an injury. So there is some tissue injury somewhere. The body detects this injury, and the first cells that do that are some of our immune cells like macrophages and neutrophils. If there is injury, there is also the release of cytokines and chemokines. Now, these are inflammatory mediators, so they start the whole inflammatory cascade. They send for help. They signal that, hey, there's an injury, we need some help. This causes a rush of blood to the area. So there is vasodilation, which increases blood flow to the area. This increased blood flow is what causes redness and heat, localized heat in the area. Also, the blood vessels become more permeable, causing immune cells and other nutrients, proteins to leak out and enter the tissue that is injured so that the tissue can heal. This results in swelling. Prostaglandins, bradykinin, and other mediators are also released. These trigger nociceptors and nerve endings and stimulate a pain response in the area. Fever is caused by the release of pyrogens. Now, the injury or the causative agent itself can release pyrogens, or the body releases pyrogens. They end up in the bloodstream, make their way to the hypothalamus, and disrupt the heat regulating center of the hypothalamus, causing a fever response. Fever response is normal. It creates an unideal environment for microorganisms. However, you don't want the fever to be too elevated. The inflammatory process continues with macrophages and neutrophils engulfing the pathogens in a process called phagocytosis. And that is how they get rid of or kill the microorganisms that are present, or any dead tissue. Get rid of any dead tissue that are present. I hope you found this helpful, and we can discuss later how we can use this knowledge to help us to frame our diagnostic statements that are related to the inflammatory process. Let me know in the comments if this helped. Give a thumbs up, share the video with a colleague.